MMT, scapular adduction, middle trapezius. Assist the patient to the prone position with the shoulder at the edge of the table. The shoulder is abducted to 90 degrees and the elbow is flexed to 90 degrees. The patient's head may be turned to either direction for comfort. Stand at the test side close to the arm being tested. Support the patient's arm with your hand under their shoulder. Using the fingers of your other hand, palpate the vertebral border of the scapula for scapular adduction. Raise the patient's arm so the elbow moves upward toward the ceiling. You are not assessing the infield, you are determining how much range the patient is able to move the scapula in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to adduct the scapula. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include using the rhomboids. With this substitution, there will be a downward rotation of the scapula not seen with the action of the middle trapezius. The patient may also use the posterior deltoid to substitute. This will cause horizontal adduction at the shoulder joint only with no scapular movement. Recall that this test is designed to test the strength of the middle trapezius. The resistance will be applied at the humerus and is allowed to break with the resistance since we are not testing shoulder strength. However, the scapula must maintain the adducted position throughout the test. After correcting any substitutions, ask the patient to perform the motion as previously. Stabilize the patient's trunk with the forearm. If the posterior deltoid is a grade 3 or above, the resistance is applied at the distal elbow. If it is a grade 2 or less, the resistance is applied over the shoulder joint. Standing next to the test arm, use one hand to palpate the scapula for adduction and the other hand to provide resistance toward the floor. Apply the force for a 5-second count. Grade 5, normal. Patient adducts the scapula through the available range and holds against maximum resistance. Grade 4, good. The patient adducts the scapula and holds against moderate to strong resistance. Grade 3, fair. The patient adducts the scapula through the full range of motion but does not tolerate any resistance. There is no position change for grade 2, 1, or 0. Support the weight of the patient's arm by cradling your arm and hand underneath the patient's arm. Allow the elbow to remain flexed. Use your other hand to palpate the middle trapezius at the superior portion of the spine of the scapula. Grade 2, poor. The patient completes full range of motion in scapular adduction without the weight of the arm. Grade 1, trace. Palpable contractile activity of the middle trapezius. Grade 0, no palpable contraction.